Hello, this is Dr. Eric Bricker, and this is how health insurance works. Today's topic is, what is COBRA? And no, we are not talking about snakes. This has nothing to do with snakes. So COBRA is an acronym that stands for a law that was passed back in the 1980s. And the name of that law is unimportant. But what COBRA is it allows a person to keep the health insurance from their job even if they no longer work there, right? So you got a job, you got health insurance through your job, you lose your job. That's a problem because you lose your health insurance, and COBRA allows you to keep that health insurance, and I will explain how. Now, the big difference is that on COBRA, the employer no longer pays the premium. You pay the premium. Now, let's go through an example because it's complicated. So when you have a job, your employer is paying about $720 a month for your health insurance. And on your pay stubs, you see money coming out for your health insurance, and it might be like $80 a month. So you're like, oh, I'm paying premium. That's right, you are paying premium, but you're only paying $80 a premium, and your job is paying the vast majority of the premium, or the $720. So now you lose your job. And so now you want to keep your insurance. So that means that you need to pay the full $800 through COBRA in order to keep your insurance. It's the same insurance plan, it's the same deductible, it's the same copay, but the difference is that instead of paying $80 a month, now you got to pay the whole thing, $800 a month. And obviously, that's a ton of money. Now, how do you sign up for this COBRA? Your job sends a letter to you several weeks after you leave. So the timing here is tricky. Let me go through it. So whenever you leave a job, your insurance stops at the end of that month. Your insurance does not stop the day you leave. Your insurance stops at the end of the month that you leave. Now, COBRA is not typically sent out until several weeks later, like I said. But it will go back and it will pay for the gap between when your insurance ended and when your COBRA starts. So let's go through an example. Let's say you leave your job on the 15th of the month. That means that your health insurance continues through the 30th of that month. Now, it moves on to the next month, and your job still hasn't sent you the letter. Then finally, on the 21st, in other words, 3 weeks after your insurance is stopped, your job finally sends you the letter. And you think about it, you scratch your head, you don't immediately sign up for it right away. If you decide to sign up for it, and let's say you decide to sign up for it on the 30th, a full month after you have lost your insurance, and let's say you had Medicare, you went to the ER, you had a prescription to fill, etc., your COBRA will go back and pay for that medical care in between when your insurance stopped and when you signed up for COBRA. Now it's messy and you're going to have to clean it up, so it's not a perfect system, but it will go back and cover that. Now there is an alternative to COBRA, because obviously COBRA is super expensive, and that is you can actually, after you lose your insurance from your job, is that you can sign up for an Affordable Care Act or an ACA or an Obamacare plan through the government, and in most states it's on healthcare.gov. Now I sell Obamacare health insurance policy, so obviously I'm biased about this, but I wanted to explain to you how COBRA works.